Okay, ready? Excellent. Excellent. Okay. You were asking about the X. That's the X. Now, people do it different ways, all right? You can do it this way, okay, right, down and up. You can do it like I did, which is this way, and then I like to do both sides, okay, at the same time. But as long as you make sure that you've covered the 6 cardinal fields, you're set, okay? So that's the X. The next thing we're going to do is we're going to look at how your eyes move, all right? So I want you to follow my finger with your eyes. Make sure it's at the patient's eye level. Follow my finger with your eyes without moving your head. And that's the important part, because if you don't tell patients, what are they going to do when you do this? They're going to move their head. Okay, she knows because she read the book. Okay, so follow my finger with your eyes without moving your head. And what I'm doing is I'm watching how her eyes are moving. So this is another thing that lets me know about lid lag. Because when I do that, if her eye comes up and her lids don't, then I know that there's a problem. The other thing that I'm looking for is when she's looking all the way out here, I'm looking for nystagmus. Who can tell me what nystagmus is? Exactly. Her eyes would move. And oftentimes when people say they're dizzy, it's not really their brain, it's their eyes are moving. So that's why they feel like they're dizzy. And the last part is we bring in our finger towards her nose and we want to see her eyes cross. Okay, does anyone remember what that's called?
Convergence.
Well, Wait, say that again?
Convergence.
Thank you. Okay, so, okay. All righty. So awesome. So far, so good. 100% in all the tests. Trying to think. Then the next thing, pen light. Sorry, I'm completely not prepared because I can't find my ophthalmoscope and otoscope, and my battery died in my pen light. So I figured I'd just steal it from somebody here. Alrighty. So the next thing we're going to do is we're going to look and see how your eyes react to light. So the first thing I'm going to do in this instance is I'm going to dim the lights. But I'm pretending to do that now because then you won't be able to see what I'm doing. Okay? Now, I'd like you to look straight at my nose. I'm going to shine a light in your eye. Okay? Oh, I see. Sorry. So what I'm looking for her pupils to constrict. I'm going to do the same thing on the other side. Oh, sorry, let me change this. Do it this way. Hold your hand between her eyes. Okay? I always have to remember that I've been doing this a very long time, so I don't have to do this, but it's better if you do it, that way when you're first starting because it makes more sense. So you're going to do that twice, because the first time you're going to look at the eye where you're shining the light, and the second time you're going to look at the opposite eye, right? For what? Consensual reaction, exactly, okay? So very good. Pupils are awesome, all right? What else is on the sheet? I feel like I'm missing something. Sheet?
Accommodation.
Yes, that's the second time. So this is, oh no, wait, accommodation, sorry, is
The finger thing, right?
No, accommodation you can't see.
No, I thought that's like when you look at the pupil dilate when you look at the distance.
Oh, right. Exactly. So accommodation, thank you. I couldn't remember that. That's terrible. It's like, it's one of those things you never do unless something's abnormal. So I'm like, I remember what that is. I can't remember what it is. So if her pupillary reaction was not normal, okay, then you can do accommodation, where you tell the patient to look at your finger and then look at a spot behind you. I want you to look at Fernando. Okay, then look at my finger again and then look at Fernando right behind me. And the abnormality would be if her pupils did not change size, right?
Right,
Yeah.
looking for
Yeah.
constriction or dilation.
Exactly. So, right,
Should get
exactly.
big
The
when I
pupils
look
should
at
constrict
Fernando.
when the patient looks from far to near. Couldn't remember what that was. Luckily, my patients don't have a lot of these type of eyes. They have other abnormalities when we get to the end of the topic. All right, so who is this?
Oh, that's mine.
Okay. All right, so last but not least, we get to play with toys. So who's going to let me use their
Big one.
Thank you. Okay, so once again, one of the reasons why I usually leave the pupillary reaction stuff to last is because you're doing it already in a darkened room, and the next thing you're going to do is you're going to use your ophthalmoscope, which also needs to be used in a darkened room. Okay, so your fundoscopic exam. So I hope everybody's gotten a chance to play a little bit with their ophthalmoscope. All right, so the ophthalmoscope. All right, this bar, okay, you see it has two sides, right? Okay, there's a light on one side, there's a little bar on the other side. That's your hint. The bar is the part that should be facing towards your face, okay? I always say it looks like an eyebrow. Remember, it's going to touch your eyebrow, because I can't tell you how many times I've seen people do this in an exam, and they're trying to figure out why they can't see anything. I was like, okay, so very important. And it's fine. If you're not sure and you're nervous in an exam, check to make sure the light is there and not shining in your face. Okay? So if you do this and you don't see a light in your hand, just very discreetly turn it around. Okay?
Or turn it on.
Or turn it on. That's true. I usually set my, okay, so somebody was asking, what are all these buttons for? So the round button here, and I'm not going to kill your battery, the round one here, okay, changes the focus. That's just like your diopter, okay? There's positive and negative depending on how bad your eyes are. Then these buttons here in the front, okay, where the lights are, all right, they change the color of the light, all right, as well as this here, which changes the size of the light and gives you other types of light. So actually, let me just show you, sorry. It's going to be better to just explain doing it this way. So see how there's different sizes? And then that gives you one color, then the slit, then this.
What's the point of the slit?
There's different types of eye exams and different things that you can be looking for. There's certain types of dye that you can put in the eye, and you can use that particular type to look at tiny slices of the eye to look for like corneal lesions and some other things and fundoscopic things. When you guys do your ophtho, they'll explain more about that. You're hardly ever going to use those unless you're in the emergency room. Okay, so most of the time, what you're going to look for is you want to look for that largest patch of white light. Okay, that's the idea. All right, so instruction to your patient. Hello, patient. Okay, I need you to look at a point over my shoulder, and I want you to stare directly at that point. Please do not look at me. Do not look at the light that I'm going to shine in your eye. Okay, I will at one point ask you to look directly into the light, but that's not going to be for a minute. All right. I usually hold my ophthalmoscope like this with my finger on this wheel because I always have to change it now that I'm old and can't see. Okay? When you first start doing this, because you want your patient's eyes to be as open as possible, you want to be able to get as much of that pupil, as possible. So what many people will oftentimes do is put their hand on the patient's head on the side that they're going to look and go ahead and have the patient open their eye and just kind of hold their eyebrow up a little bit. Always remember, right hand, right eye, patient's right eye. All right, and you know you're wrong if you're face to face with the patient like this. You're on the wrong side. Okay, so very, very important.
You mentioned yesterday that if you wear glasses, you should take them off.
Oh, I'm going to. I'm not taking my. I just keep my glasses on now because I can't see you without them. Okay, but that's one of the reasons why I keep my finger like this because I'm going to have to change the focus. I can't see anything anymore at zero. Officially old. It's terrible. Okay. No, I'm going to leave these on for a minute. Because the first thing we're going to do, and I don't know if you're going to be able to see it because there's too much light in here, but if I can get you to look straight ahead for me. They talk about finding the red reflex. I don't know. I don't think we're going to be able to see it in here. Sorry. Hold on. Let me turn the light off.
Sorry about that.
No. Sorry.
They're really dilated.
Okay. Yes, exactly. You'll be fine because you also have light eyes. People with light eyes are awesome. Right? So, and I'm also not going to blind you with such a bright light. Like I said in the beginning, you want to make sure that you use, you can see. Do you see a reflex?
Did you see the white shine like they said also?
Mm-hmm. That's the other thing, okay? You see the white shine in her pupil?
Yeah.
That's the light pointing into her pupil. Okay? So they talk about the red reflex, and unfortunately, I'm not getting one on her, and I want to stop shining a bright light in her eye, so I apologize. But that's the other thing that you can look for is just the reflection of the light. So at least you know you're in the right place. All right? So, because here's the thing. When you're putting the ophthalmoscope up to your eye, You see how the light is on my hand? Yeah, when you're in your exam, don't do this, because they're going to be like, really? You're looking into the eye? Really? Okay? So if nothing else, make sure that you see that white light reflex. Do you see it now?
Yeah.
Okay. See, I can see very well into her eye right now.
Really?
Thank you for having light eyes. That's awesome. All right. There is, actually, if you want to, because I don't know if you guys can see this, so go ahead and you can turn the light back on. It's fine, because I'm looking at her now. Okay? And so,
You still see the white light.
yeah. Yeah, because she's got light eyes, which is awesome. Okay, there we go. Perfect. Now I can actually see. So, there is her optic nerve, and there's a nice blood vessel. Let's follow that. See what I mean about you have to kind of move around a little bit to actually see things?
We have like completed the eye already.
Okay. Sorry, I know it's bright. I apologize. But
She volunteered.
and your eyes are perfect. No. So yeah, but that's basically what you're going to do. So that's why they tell you to look for the red reflex. If you don't see the red reflex, which I realized the other reason why we didn't see it was because the lights were on. Because as soon as the lights went out, your, fundus just went pop into view. It was beautiful. Okay, it's like, oh, this is great. But yeah, so practice just getting the technique down, and then we'll turn the lights off so you guys can actually see each other live, because you really can't with the lights on. It's impossible. Okay? And unfortunately, all the lights go on and off in this room. That's the only big problem with this room. Okay?
Thank you.
You're more than welcome.